Hello, this is CityScape, a regular vodcast featuring people, places, and ideas that impact Livonia. I'm Dan West with the Livonia Chamber of Commerce. The Beaumont Health System is building a new four-story outpatient surgery center off of 7 Mile Road near I-275, which will give Michigan's largest healthcare system its first direct care facility in Livonia. Construction began last year on this 35-acre site that was formerly occupied by a manufacturing company. Beaumont leveled the former A123 Systems building to make room for the new medical facility. We are joined today by Kevin Price, the Chief Operating Officer for Beaumont's Grosse Pointe operation, who also has operational responsibilities for the forthcoming outpatient campus in Livonia. He was the Vice President of Operations at Beaumont Hospital in Farmington Hills, formerly called Boxford Hospital. Kevin, thank you for joining us today.
Thank you, Dan.
Why don't you tell us what's all expected to take place at this new outpatient facility in Livonia, and when do you expect it to be up and running?
Yes, so the new facility in Livonia is, as you mentioned, on 35 acres. It's approximately 125,000 square feet, four-story building. And we'll be providing a number of services at that location, including a number of physician offices or practices in the building. The facility will have a freestanding emergency center, as well as a number of other services, including imaging services, pharmacy services, infusion services, lab services, physical therapy. So quite a variety, some cardiology services, some outpatient services that we're really trying to reach out to our communities to make sure that we're providing good quality care locally. That is what we're trying to ensure that we are closer to our patients in the community, so they don't always have to come to a hospital for those types of services. And we are also looking to continue to provide good quality care at a lower cost. So it's a continuous challenge to make sure that we are out there as close to the community as possible, providing what is needed there, and continuing to look at where the demand is and growing services that are necessary to meet the needs of our communities.
How many people do you suspect will be needed to staff this facility?
From Beaumont's perspective, so Beaumont will have a little bit more than half of the building that will be providing direct services in. And we expect around 100 or so employees from Beaumont's perspective. The physician practices that will be in the building will probably have somewhere close to that number of employees as well.
In preparation for hiring at the Beaumont Outpatient Campus, Livonia, aside from doctors and nurses, what other types of talent do you suspect you'll need to work in this building?
Sure, we'll need, as I mentioned, we have things like imaging services. So we'll need radiology technologists, physical therapists, pharmacists, people who are involved with the whole registration process, checking people in for services. So quite a variety of different services. And the physician's offices may need some support staff, definitely some nurses. We'll need nurses, obviously, throughout the different services that I mentioned. And then there's medical assistants in the physician's offices. I'm sure that they'll need as well. Some laboratory techs, phlebotomists. So quite a variety of positions.
And for a lot of these types of positions you're talking about, it is basically a 2-year associate degree type of training that people become eligible for these types of jobs, correct?
Correct, yeah, at least that. Many of them require bachelor's and master's, and some even doctorate degrees, like in pharmacy, that can be a master's or doctorate.
But basically, all levels of education will make you eligible for the jobs you're looking to hire here.
Correct.
What new trends in healthcare are you seeing that influence this new project in Livonia?
Trends in healthcare are continuing to look at providing the right care at the right place, the right time for all of our patients. So it's really moving more and more towards making sure that we're providing great quality care. It's easily accessible for patients. It's low cost, and always trying to make sure that we're looking at where where are the needs changing? You know, what based on demographics of the community and the health of the community, what are the greatest needs? So continuing to look at those things and make sure that we're providing the services that are most needed for the community based on those demographics and what we're seeing as demand. And as technology changes too, there's opportunities to address that too, to make sure that we're providing the latest care and the most up-to-date care for all of our patients.
And not only Beaumont, but there are two other healthcare systems that are making significant investments, basically within a stone's throw of your new building. What is it about Livonia and the I-275 corridor that was attractive to Beaumont, to the healthcare industry in general at this time?
Well, as I mentioned, I think it's really important to be very accessible to the communities. So that location, it's easy access, easy to get there off of the expressway, as well as I mentioned, just reaching out in the community. We have a lot of patients in those communities, and we want to make this the services that we provide as accessible to them as possible, which I'm sure the other health systems are trying to do as well. We are all, looking at providing care in a kind of a more accessible way for patients. And as technology continues to change, making sure that we are able to bring that technology and those services closer to the community and to our patients.
Now, this facility is on 35 acres. You will still have quite a bit of land around the building when you're done. Do you anticipate the need for potential expansion in the future?
Absolutely. I think that as time goes on, things change and the demand will change, and there's flexibility on that land to be able to expand if we need to. And it's hard to say what that would be at this point. It will take shape over time, but we want to make sure that we have that flexibility so that as the need grows, if we need to provide other services on that campus, that we have space to do that.
Kevin Price, a COO with Beaumont, has been our guest today. Kevin, thank you for taking time to speak with us.
Thank you very much, Dan. Have a great day.
And that's all we have for this edition of Cityscape. We thank everybody for watching, and we'll see you next time.